Have you ever experienced back pain? You're not alone. This uncomfortable sensation, often likened to a dull ache or a sharp stab, is a common plight that binds a significant portion of the population worldwide. It is a silent foe that creeps in uninvited, bringing along discomfort and strain, hindering our daily routines and sometimes even our zest for life. Back pain can be a complex issue with a myriad of causes and varying degrees of severity. It can be sporadic or chronic, mild or debilitating. Different individuals may experience it differently, and thus it is essential to understand the causes, symptoms, and potential remedies of back pain. In a world where we are constantly on the move, understanding this ailment is not just about finding relief, but also about prevention. It's about learning to listen to your body and giving it the care it deserves. Remember, understanding the causes of back pain is the first step towards finding effective remedies. Back pain can stem from various factors. It's a discomfort that can sneak up on you, often a result of everyday activities, and it's something that many of us have experienced at some point. One of the most common culprits of back pain is poor posture. Slouching, hunching over your computer, or constantly looking down at your phone can put unnecessary strain on your back muscles. Over time, this can lead to chronic discomfort. It's an easy trap to fall into, especially in our modern world where a large number of jobs involve sitting at a desk all day. Speaking of sitting, a sedentary lifestyle is another common reason for back pain. Our bodies were designed to move, and when we spend hours on end sitting down, it can lead to weakening and imbalance of the back muscles. This in turn can make the back more prone to injury. Heavy lifting, especially when it's not done correctly, is another significant contributor to back pain. Lifting objects that are too heavy or lifting them with your back rather than your legs can result in sudden and severe back injury. It's a common occurrence in occupations that involve manual labor, but it can also happen in everyday life, like when you're moving furniture or carrying heavy grocery bags. Age also plays a role in back pain. As we get older, our bodies naturally go through wear and tear, and our backs are no exception. The discs in our spine can degenerate over time, leading to conditions like osteoarthritis and herniated discs, both of which can cause back pain. Certain medical conditions can also lead to back pain. These include conditions like scoliosis, where the spine curves to the side, or osteoporosis, where the bones become brittle and fragile. Both of these conditions can put strain on the back and cause pain. Identifying the source of your back pain can help you find relief and prevent further discomfort. Whether it's poor posture, heavy lifting, a sedentary lifestyle, age, or a medical condition, understanding what's causing your back pain is the first step towards finding a solution. Back pain has several underlying causes. Let's imagine the back as a complex structure made up of bones, muscles, nerves, and discs, all working in harmony. When one or more of these components encounter a problem, the result can often be back pain. Starting with the spine, it's a marvel of natural engineering, providing structural support and housing the spinal cord. However, when conditions such as osteoporosis, scoliosis, or spinal stenosis set in, the resulting discomfort can range from mild to severe. Now, let's think about our muscles and ligaments. They do a tremendous job supporting our body weight and allowing us to move. But strain them through heavy lifting or sudden awkward movements, and you've got a recipe for pain. This is often referred to as a pulled muscle or back strain. Moving on to the discs, these are the shock absorbers tucked between each of our vertebrae. They're tough on the outside, soft on the inside, much like a jelly donut. But when they herniate, which means the soft inside pushes out through a tear in the tougher exterior, it can irritate nearby nerves and result in a lot of pain. Speaking of nerves, they're like the body's electrical wiring. When everything's working as it should, you're fine. But when a nerve gets compressed or pinched, which can happen because of a herniated disc or bone spurs, it can cause radiating pain, numbness, or weakness. Finally, we can't ignore the role of stress and mental health in back pain. Emotional distress can lead to muscle tension, creating a vicious cycle of physical and emotional discomfort. Conditions like depression and anxiety often have physical manifestations, including, you guessed it, back pain. So, from your spine to your mental state, there's a multitude of factors that can contribute to that ache in your back. It's not just about physical strain or injury. It's a complex interplay of physiological and psychological factors. Understanding the cause of your back pain can help guide your treatment approach. Prevention is always better than cure, especially when it comes to back pain. Delving into prevention techniques, the first and foremost method we can't ignore is maintaining good posture. Whether you're sitting at your desk, standing in a queue, or lounging on your sofa, posture plays a pivotal role in preventing back pain. Avoid slouching and ensure your back is aligned properly, with your shoulders straight and your body weight evenly distributed on both feet. Now let's not forget the power of regular exercise. It's like oiling a machine, keeping your body, especially your back, flexible and strong. Incorporate a mix of strength training, cardio, and flexibility exercises into your routine. Yoga and Pilates are excellent for strengthening your core and improving flexibility, both of which can help ward off back pain. But what about those of us who are tempted to play Hercules and lift heavy objects? Well, it's time to put that superhero cape away. When lifting heavy objects, make sure to bend your knees and use your legs instead of your back. If the object is too heavy, don't hesitate to ask for help. Remember, your back is precious and it's not worth the risk. But prevention doesn't stop at physical measures. It's also about what we put into our bodies. A healthy diet rich in calcium and vitamin D can help maintain strong bones and prevent back pain. Include foods like dairy products, fish, and leafy green vegetables in your diet. Finally, let's talk about the elephant in the room: stress. Chronic stress can lead to muscle tension and trigger back pain. So, it's essential to incorporate stress management techniques into your life. This could be anything from meditating, reading a book, taking a walk, or simply spending time with loved ones. Incorporating these techniques into your lifestyle can significantly reduce your risk of experiencing back pain. So let's start today and make back pain a thing of the past. Sometimes back pain strikes despite our best efforts. It's an unwelcome guest that can disrupt our daily routines. But fear not, there are several home care remedies available that may offer relief. One of the simplest and most effective remedies is rest. Our bodies have a remarkable capacity to heal themselves, and sometimes all they need is a little downtime. But remember, too much bed rest can exacerbate back pain, so it's a delicate balance. Aim for short periods of rest, followed by gentle movement to keep the back flexible. Next up is heat and cold therapy. Applying a warm compress or heating pad to the affected area can help relax tight muscles and improve blood flow. On the other hand, a cold pack can reduce inflammation and numb the area, providing pain relief. It's worth trying both to see which works best for you. Over-the-counter pain relievers such as ibuprofen or acetaminophen can also be effective in managing back pain. However, these should be used sparingly and only as a last resort, as they only mask the pain and do not address the underlying cause. Gentle stretching exercises can also be beneficial. Simple movements such as knee-to-chest stretches or pelvic tilts can help strengthen your back and improve flexibility, but remember, it's important to listen to your body. If a stretch causes more pain, stop immediately. Lastly, let's not forget the importance of a good posture. Whether you're sitting, standing, or lifting heavy objects, maintaining a proper alignment can go a long way in preventing back pain. Now, these remedies can provide temporary relief, but it's crucial to remember that if your back pain persists, becomes severe, or is accompanied by other symptoms such as fever or weight loss, it's time to consult a healthcare professional. They can provide a thorough evaluation and guide you towards the most appropriate treatment. These remedies can provide temporary relief, but it's crucial to consult a healthcare professional if your back pain persists. Back pain can be a significant hurdle, but knowledge is power. As we draw this enlightening journey to a close, let's take a moment to revisit the essential points we've covered. We've delved into the common reasons for back pain, such as poor posture, muscle strain, and even stress. We've also looked at the causes with a particular focus on conditions like osteoporosis and arthritis. Moving forward, prevention is better than cure. We've explored techniques to help you avoid the progression of back pain. Regular exercise, mindful posture, and a balanced diet are your best friends here. And let's not forget, home care remedies can offer significant relief. Simple steps like heat or cold treatment, rest, and over-the-counter painkillers can make a world of difference. In the end, it all comes down to understanding your body and its needs. Remember, understanding your back pain is the first step towards finding relief. Take care of your back and it will take care of you. Care